Naitala na sa Thailand ang unang kaso ng Omicron XE ay sa Vice Chairman ng Thailand Public Health Commission na si Chalemchai Boon Yalifan sa Center for Medical Genomics Ramathi Bodhi Hospital ay talang nasabing kaso pero gumaling na rin ang individual na nahahawaan nito pagkatapos magkaroon ng banayad na sintomas. At kaugnay diyan, makakausap natin ngayong umaga si Dr. Ron Jean Solante, isang eksperto sa infectious disease, upang alamin natin kung ano ba ang mga katangian ng Omicron XE na ito. Magandang umaga, Dr. Solante. This is Aljo Bendijo. Kasama si Dayan Kirer.
Hi, good morning, Aljo.
Ano ba katangian itong bagong Omicron XE, Doktor?
Well, ang initial reports is pertaining to, this is a recombinant of the BA1 and BA2. So pinaghalo ang mutation ng BA1 and BA2. So that means it is expected that you will have a more transmissible variant or a COVID virus. And I think WHO has already mentioned that it is 10% more transmissible than the BA2. And you know, BA2 is the one that is the dominant variant now in most countries. And if you are looking at an XE Omicron more transmissible than this, then that will be really be dangerous in terms of it might overlap and it might be the dominant variant of concern, although it's not been declared by the WHO as a variant of concern at this point in time.
Opo, katulad po sa sitwasyon ko, Doktor. Nakumpleto ko na yung fully vaccinated na ako, nakapag-booster shot pa. Ako ba'y protektado niyan? Omicron XE na yan? Well, although you have to follow itong tinatawag na minimum health standard.
Yes, no, Aljo, no? Those who are boosted, especially within 3 months, are still being able to protect ourselves, no? Our immunity against this Omicron variant is still there, no? What's the concern now are those who received the primary vaccine series and has not received the booster dose, because when Omicron came, most of the effectiveness of the vaccine dropped significantly. And when you are giving the booster, it will be maintained higher, like 60 to 70%. So, in short, we need to vaccinate and give the booster dose to the population now.
Pwede ko bang sabihin, Doktor, na para talagang mabigyan ako ng proteksyon, magpa-booster na naman ako? O ibig sabihin nun, pang-apat na bakuna?
Okay, now, the second booster is only recommended for those 60 years old and above, those who are immunocompromised. Why? Because these are the population with the first booster. It's not enough to build that immunity because of their conditions. But for you, without comorbidities, those less than 60 years old, then that will not be the priority. So you're still good with the first booster dose.
Dr. Solante, magandang umaga po. Si Dayan Kirer po ito. Dok, bukod po dun siyempre sa bakuna at booster, may kailangan pa bubang karagdagan na ipatupad sa mga existing health protocols po natin para po makaiwas po dito sa Omicron XE, Doc?
Napaka-importante ngayon, Dayan, na huwag magtatanggal tayo ng mga face mask natin. We know that the face mask is the direct barrier against any aerosol or any airborne particles of the virus, Now, ang nangyayari ngayon, medyo kumakampante ang mga tao, nagtatanggal, So we need to emphasize again, the only way to be protected directly against aerosolization, droplet, is wearing the face mask properly and consistently.
Naku, sana'y wag naman po pumasok itong Omicron XE na to sa ating pong bansa. Pero Dok, sa mga lumalabas pong mga siguro pag-aaral po sa ibang bansa, ano po ba yung mga sintomas po nitong Omicron XE na ito? Kasi po kung maaalala natin, yung mga past variants po, yung loss of smell and loss of taste, yung fever and colds, may mga bagong sintomas po ba itong Omicron XE, Doc?
So far, Dayan, no, wala pang nakikitang kaibang symptoms itong bagong XE Omicron. No? Based doon sa experience sa Thailand and in those in UK, more or less, no, nandun pa rin yung lagnat, no, masakit ang katawan, may ubo, and then yung loss of smell and loss of taste, nandun pa rin. No? So, in short, it's difficult to really differentiate any symptoms that is characteristic or doon lang naiiba sa isang variant of concern. So, ang importante dito, we need to communicate with the people. Kung meron kang mga ganitong sintomas, then mas importante mag-isolate. But if you are a vulnerable population like 60 years old, especially immunocompromised, mas maigi magpa-test kasi meron naman tayong mga gamot ngayon available against this COVID-19 virus.
Okay, Doc Solante, as a health expert po, sa inyo po bang palagay, do we need to restrict again yung borders ng Pilipinas para po maiwasan na makapasok itong Omicron XE sa Pilipinas? Kasi kung mapapansin po natin, marami na rin po mga turista ang dumadayo po sa ating bansa para po dito po magbakasyon, Doc. Ano po ang inyong opinion dito?
Okay. For now, I don't think restricting our border is an option. No? Ang importante lang talaga dito is that anybody who comes in the Philippines, sana bakunado na, no? At saka fully boosted na rin. No? Isa yan sa mga dapat requirement. And then the possibility that when they will be symptoms, they should also be advised to isolate and at the same time to monitor for that. No? And sa akin, that will be okay, no? As long as we have those policies, protocol in place and should be complied with.
Maraming salamat po sa inyong panahon ngayong umaga, Dr. Ron Jean Solante. Stay safe po, Doc.
Thank you.